Hello everyone. So today we will learn about vulva. Outline of this chapter will be definition, components of external genitalia which are labia majora, minora, mons pubis, clitoris, vestibule, external urethral orifice, hymen, vaginal orifice, Bartholin glands and their ducts, vestibular bulbs, arterial supply, nerve supply, venous drainage, lymphatic drainage of vulva, and last clinical importance. So why it is important? Basic knowledge of anatomy of female genital organs helps to understand the physiological changes in pregnancy. It is useful during obstetric operations to avoid injuries to the vital structures. So, what it comprises? Female reproductive organs are broadly classified into three categories: external genitalia, which is vulva, our today's topic; internal genitalia, accessory reproductive organs, which is breast. So, what is vulva? Vulva or pudendal lies outside the body in the midline, bounded anteriorly by the mons pubis, posteriorly by the perineum, and laterally by the thighs. There are almost 9 parts of it, so we will go step by step. First of all, it is labia majora. So, what is it? It is a fibrofatty fold of skin which is lined by stratified squamous epithelium, and it is homologous to the scrotum in males. Anteriorly, it is covered by mons pubis, and posteriorly, it forms posterior commissure. Outer area is pigmented and hairy, and inner area, which is smooth, have sebaceous glands, have blood vessels, lymphatics, and nerves. Okay, so labia minora, it is too delicate fold of skin which is moist, devoid of fat and hairs, reddish in color, which is similar to the mucosa. Anteriorly it forms clitoris and posteriorly it forms foreskin. It comprises connective tissue, erectile muscles, sebaceous glands, blood vessels, and nerves. Fine. You have mons pubis, which is a rounded, hairy, sebaceous, fatty mass. Then we have clitoris, which is erectile structure homologous to penis. In males, it is almost 2 cm in length. Have two parts, one corpus and two crura. Normally, the size of clitoris is 18.5 to 35 millimeters of square. Vestibule, it is an almond-shaped structure extended from clitoris to foreskin. 4 openings, which are vagina, urethra, 2 ducts of Bartholin glands. External urethral orifice, it is a midline antero-posterior slit which is 1.5 centimeter below pubic arch. Skene's ducts opens on the posterior wall or on the sides of urethra. Then we have hymen. It is a septum of mucous membrane. When it gets torn, it forms cicatrized nodules, also known as carunculae myenteriformis or hymenal tags. Vaginal orifice, it is a median slit behind urethral orifice or opening. It gets dilated on coitus or childbirth. Then you have Bartholin glands and ducts. It is a 2 pea-sized oval secretory glands at 4 or 8 o'clock position. They are present in the superficial perineal pouch, and their ducts opens in between hymen and labia minora. They secrete alkaline mucus. When get infected, it forms abscess. Vestibular bulbs, bilateral elongated mass of erectile tissue on either side of vaginal orifice in front of Bartholin glands. So these are all the parts of external genitalia. Then we will come to arterial supply. So it is the structure here of vulva. Here it is clitoris, it is urethral opening, vaginal opening. It forms foreskin. So we have external pudendal lump which supply to the anterior region of the vulva, and it have superficial and deep branches. Then we have dorsal clitoral artery and deep clitoral artery, which supplies mainly to the clitoral region. Then we have labial artery to the vestibular bulb, or perineal artery, and these all are branches of internal pudendal artery. Then we have nerve supply. So color coding helps you to easily memorize it. This blue color is your inguinal nerve, green is your genital branch of genitofemoral nerve, purple is your posterior cutaneous nerve of thigh. Then we have perineal nerve and pudendal nerve, or we can say perineal branch of pudendal nerve. Then venous drainage, plexus drains into the internal pudendal vein, which ultimately drains into the internal iliac vein. Vesical vein, vaginal vein, and long saphenous veins, they all drain the venous drainage of vulva. Then we have lymphatic drainage. So the vulval region, first of all, drains lymphatic of vulval region drains into superficial inguinal group of lymph nodes. Then they will reach to the deep inguinal lymph nodes. Then ultimately they will reach to external iliac group of lymph nodes. So last topic is clinical importance, carcinoma of vulva. Spread first, so when the cancer of vulva taken to place, they spread first to the ipsilateral superficial inguinal lymph nodes, then to the deep, and ultimately to the external iliac and pelvic group of lymph nodes. That helps in staging and planning of surgery. Sorry. Sentinel lymph node biopsy helps in early vulval cancer detection, reduces lymphedema, infection and inflammation, Bartholin gland abscess, vulvitis, cellitis, STIs, sexually transmitted infection causes inguinal lymphadenitis. Systemic disease, Crohn's disease. Like in Crohn's disease, there may be cases you can see vulval edema or ulcers, or in diabetes mellitus, there can be recurrent vulvovaginal candidiasis. Obstetric and gynecological cases, perineal trauma, tear or episiotomy, vulval hematoma, sexual dysfunction or the dyspareunia, vulvodynia, it is a neuronal problem, or medico-legal cases. Thank you.